So today's topic is, you have already read about it in your microbiology and also in when vaccine was taught, na? So this will be a rapid one. I will just enumerate the important points. Please try to read those points. And when I taught you the vaccination, I also gave you some pages from Harrison and Davidson, screenshots. Okay, the diagnosis, the treatment. Please go through by those. Okay. So viral hepatitis or communicable hepatitis. We have one different non-communicable hepatitis, and for that we have one program. That program comes under NPNCD. What we are most serious about, that is the liver cirrhosis or liver carcinoma caused by those hepatitis, and the communicable thing, because that is the prevalence of those communicable hepatitis is much more. So we are focused on that. So which can anyone tell me which hepatitis virus is mostly associated with hepatocellular carcinoma? No. C. B na hole C hobe. তাই তো লাইফে দুটো চয়েস কি পাবে? And liver cirrhosis. What is the most common cause of liver cirrhosis in India right now? Alcohol. Correct. But I don't know about the current data statistics, but very soon it will be NFLD, that is non-alcoholic fatty liver disease. It is totally different from viral or everything. It is separate. What is the reason of that? Because of our eating habits. Okay. So coming to today's topic, that is viral hepatitis. First, what is viral hepatitis? It's a systemic disease with primary inflammation of the liver. Hepatitis means always inflammation of hepatocytes, nothing else. Okay. It's by a group of hepatotropic virus. What is hepatotropic virus? Those viruses which are going towards your going towards the hepatocytes. Okay. That means those who are attacking the liver. What are those? We have hepatitis A to E and also F. Among those, A to E, all are parenteral, B, C, D are bloodborne disease. F is currently, it is now a theory that hepatitis F also can be transmitted by blood transfusion. Okay. In addition to these hepatitis viruses, we also have other hepatotropic virus, which is herpes simplex, cytomegalovirus, Epstein-Barr virus and yellow fever. Of those, yellow fever is not of any importance because yellow fever case in India is 0. Okay. There is no yellow fever cases in India, but India has the ideal environment for it. That's why in international health regulation, which came as a short note in your last MBBS exam. So this time you can also expect it as explain why question in your MBBS exam. Okay. Yellow fever vaccination is that much mandatory if you are traveling to any country where yellow fever virus is prevalent. In clinical terms, hepatitis is inflammation of liver. What is acute viral hepatitis? If symptoms last less than 6 months. What is failure? If the hepatocytes failed or stopped to perform their duties. What is chronic? It is at least 6 months. That means 6 months or more is chronic, 6 months or less is acute. Okay. This acute and chronicity is only based for hepatitis. For any other disease, acuteness and chronicity defined maybe differently. Now, what is fulminant hepatitis? Severe impairment of hepatic functions or severe necrosis of hepatocytes in the Absence of pre-existing liver disease. Fulminant hepatitis we usually see in pregnant women. Okay. What are the cause? We come to it later. Coming to the viral hepatitis, we usually mainly concerned on these infectious A and what is present it's transmitted via serum, that is B and D. What is NAMB? That is not A, not B hepatitis viruses. Okay, what are those E, C, G and F? Of those E is enterically transmitted, C is parenterally transmitted, and here I have given one table. Okay, here the agent, route of transmission, the age it mostly affects, and carrier state, incubation period, chronic infection, specific prophylaxis. These are given in a short. Okay, this is for your examination only. Try to remember the table. In that, incubation period for viral hepatitis B is very much important. Remember that incubation period is 6 months. Okay, 180 days, 6 months usually. That is the answer you will get in your MCQ. Okay, not in between bits. Coming to the hepatitis A, first it is formerly known as infectious hepatitis. Is an acute infection caused by hepatitis A virus. Before we came to know about hepatitis B virus and its transmission by blood and also sexual activities, hepatitis A was much more common in our world. Okay, because it mostly carried by water. Okay, that's why it causes a epidemic jaundice. That the jaundice we have in hepatitis A or B, we have anicteric and icteric phase. The icteric phase of hepatitis A much more prevalent and common and noticeable. That's why previously only hepatitis A was formerly known as infectious. Okay, it's explained why. The disease also heralded by a non-specific symptoms such as fever, chill, headache, and also generalized weakness with ache and pain, followed by anorexia, nausea, vomiting, and finally dark urine and jaundice. How we determine jaundice? We try to examine for icterus, and the icteric phase is we usually diagnose it at the icteric phase of the patient. Okay. Otherwise, that's why if a patient comes to you with complaints of anorexia and itching, you must check for LFT. Okay, it might be hepatitis or it might be cholestasis. So even if a patient comes with you anorexia, you first check the patient's LFT. Okay. Also, the disease is benign with complete recovery in several weeks. Usually we do not have to do something. What are the epidemiological determinants? Agent is hepatitis A. It's a enterovirus of picornavirus family. It is very commonly asked. Okay, picornavirus. And this line, it multiplies only in the hepatocytes, which is a specific feature for hepatitis A. What are the resistors? It is fairly resistant to heat and chemicals. Withstand heating to 60 degrees centigrade for 1 hour. Okay, and also normal chlorine that is present in your water. Hepatitis A virus is resistant to that. That's why we see much more cases of jaundice of hepatitis A, because water is over in environment. Water, it's taught in your second year or first year. We saw today. Okay, it is over. It is already taught. So, what are the normal chlorine level and what not? You must read. What are the normal chlorine level in the water cannot kill hepatitis A virus. That's why the jaundice cases are that much more. But what is the ideal disinfectant for hepatitis A? That is sodium hypochlorite solution. Even formalin, it can kill the hepatitis A. What are the reservoirs? The human cases are the only reservoir of hepatitis A. Okay. What is the period of infectivity? Is greatest from 2 weeks before to 1 week after the onset of jaundice. Try to remember this point. Okay. It has been much asked. In what are the infective material? That is the human feces. Virus excretion, HIV is excreted in the feces about 2 weeks before onset and for up to 2 weeks thereafter. That means after the post period of infectivity, only 1 week the person will secrete hepatitis A virus in his feces. What are the host factor? That is adult. It is most frequent among children than in adults. However, people of all ages may be infected. The clinical severity increases with age. It is a potential explain why. If a jaundice, hepatitis A affected child and adult, whom we give much more priority. That is an adult affected with hepatitis A virus, because the clinical severity increases with age. The anicteric and icteric phase, if we get a ratio, for children it is 12:1. That is, in 12 anicteric children there will be 1 icteric severe phase. Okay. Sorry, if from 12 anicteric children only 1 will create severe icteric phase, but the ratio is totally reverse for adults, that is 1:3. That means among 4 HIV patients, 3 will show severe icteric phase, 1 will show a prolonged anicteric phase. Getting the point? The prevalences of anicteric and icteric is totally reverse for adults. So, if a person in his adulthood gets affected with hepatitis A virus, we have to take care of the patient much more. Okay. For gender, it is almost equally susceptible. All are equally susceptible. Immunity after attack probably lasts for life. Only 5% second attack has been reported. Okay. What are the environmental factors? Cases may occur throughout the year. In India, the disease tends to associate it with periods of heavy rainfall. So, in rainy season, you will see much more cases, even in autumn. Okay. What are the incubation? 10 to 50. It is already a mode of transmission, that is fecal-oral, parenteral, and sexual transmission. It may occur, but we only see it on homosexual men. Okay. What are the diagnoses? Demonstration of virus in feces, blood, bile, isolation. We also can detect the antibody by ELISA. What are the biochemical tests? That is ALT, bilirubin, protein. And what are the molecular diagnoses? That is RT-PCR. This is what, please study this, that when the IgG, when the IgM will appear. Okay, first the appearance of IgM after 3 weeks before 4 weeks of infection. Okay, it will get peaked at 6 and then the titer will gradually drop. And IgG, it actually appears post 4 weeks. It actually appears post 4 weeks of infection and it lasts for a lifelong. That is why it is coming to a standstill in the later curve. Okay, that's why the protection against HIV is lifelong, because IgG will persist for the rest of its life. What are the prevention? We can control the reservoir. What were the reservoir? So we can disinfect the feces of the humans by treating it with sodium hypochlorite or the formalin, and control of transmission by the maintenance of hygiene, that is hand washing. Okay, proper hand washing, nothing else. Also control of susceptible population. We have 2 types of vaccine, one is killed, which is very much ineffective, one is live vaccine, usually given 1 month apart, okay, but these are not used in India, okay, so do not expect any questions from that. What are the treatment? That is non-specific, only dietary restriction. Coming to your next most important virus, that is hepatitis B, also known as Dane particles, okay. It's formerly known as the serum hepatitis because of its transmission through bodily fluids. It is also the acute illness, causes liver inflammation, vomiting, jaundice and rarely death, but chronic hepatitis B may eventually cause cirrhosis, okay, may, but most common associates with hepatitis C because it is easily transmitted by multiple routes, not only by blood transfusion or blood-borne infection. That's why hepatitis B is much more importance, okay, and also by vaccination it is easily preventable. That's why the importance is much more. And also for prevalence, always remember the 5 word, okay. Later I will come to it 5C and remember the word 5. If asked what is the global prevalence of hepatitis B, that is 3.5 to 5%. What is the case of in case of India, that is 5 to 7%, okay. So the main number you have to remember, that is 5. In hepatitis B we have 5C and hepatitis B, if the number 5 is important. Also in treatment also the number 5 is important. If you go through the previous slides of vaccination you will understand, okay. And also hepatitis B causes co-infection associated with hepatitis D and hepatitis C virus, okay. So the co-infection cases are much more common in hepatitis B infection. What are the agent factors? That is hepatitis B virus. It's a complex 42 nanometer double celled DNA virus, originally known as Dane particle. It usually replicates in the liver cell, but not only in liver cell, okay. And it occurs in 3 morphology form in the serum, that is small spherical particle with an average diameter of 22 nanometer, one filamentous, and third is Dane particle. But in hepatocytes only as Dane particle. Out of 3 morphology forms, only Dane particle is considered infectious, okay. Only the Dane particle, that means the complete form of HBV, is infectious, not the other 2. And in serum, the circulating morphology is, bulk of it is only this one, small spherical, 22 nanometer of size. These are the pictures. This is the complete Dane particle, okay. Sometimes it might come as elongated. This is a 42 nanometer Dane particle picture in cross section. Here we are getting the surface antigen, where it is, this one. Then coming to the DNA polymerase, DNA mostly double stranded, that is 32 base pairs, 3200. This is the core antigen, these small squares, and also in there its protein kinase, okay. If possible, try to remember this. And the reservoir is main in, like hepatitis A, main is the only reservoir of infection, but what are the infective material? Contaminated blood, unlike contaminated feces, okay. And resistance, it's capable of staying alive for 7 days in the environment. That's why hepatitis B affected person and even the surface has to be cleansed with sodium hypochlorite thoroughly, because it can survive in even outside human body for 7 days, okay. For HIV it is mere some minutes, but hepatitis B, it can survive even 7 days, okay. It is readily destroyed by sodium hypochlorite or by heat sterilization. What are the host factors? Here comes to the acute hepatitis B, that is 90% resolved by themselves, only less than 1% develop fulminant hepatic failure. And what is chronic hepatitis B? It is seen in 10%, cases. Okay, that's why we are much, if 10% prevalence is, we have to think about in 150 crore population, the cases is much more. That's why we are concerned about this. Okay. In case of perinatal transmission, it is 95% chronicity, or childhood infection is 80%. But after 5 years of age, it is only 5 to 10%. Who are the high risk group? That is people from endemic region in our state, where you all now reading FMT, na, substance abuse. Which state is highest in using IV needles? Punjab. At smoking? Which state is leading in smoking abuse or is nicotine abuse? Hey, Bengal. Okay, and alcohol? But सब उड़ता पंजाब माने सब दी दी कि एगलो तो किस ना बिहारे बैन रे रे जाने ना माने किस हाँ मुंबई की स्टेट Maharashtra is leading in alcohol, we are leading in nicotine, and Punjab is leading in IV drug users. So when we must see the endemic regions, that is Maharashtra and Punjab. Okay. Now intravenous drug abusers, people with multiple sex partner, hemophiliacs, healthcare personnel who have contact with blood. That is why I advised all you about before you start your internship period, please get a hepatitis B vaccine booster. Okay. And patients who are immunocompromised, they are the gone people, they are high risk for everything. A humoral and cellular response, the hepatitis B has had 3 distinct antigen, that is surface antigen HBsAg, core antigen HBc, and envelope antigen, that is HBe. Among those, HBsAg is known as Australian antigen and the most common antigen which we measure about. Okay. What are the incubation? As I said, that is 6 months. Mode of transmission, that is parenteral, sexual and perinatal. Vertical transmission is seen in hepatitis B virus. Okay. What are the diagnostics? That is serology, liver chemistry test, histology, immunoperoxidase staining, and also we can demonstrate the viral DNA by RT-PCR or even only PCR, and it is the most accurate marker, that is HB viral DNA, and obviously the liver biopsy in a fulminant cases. Okay. These are the serology you already read it in microbiology. Okay. Please remember what was those HBsAg, then HBe, then coming to the anti-HBs, and what is the last? Which of the marker comes last? দেওয়াই তো আছে anti-HB core antigen, that is comes to the last. Okay, and what comes to the first? That is HBs. Only remember those things. These are the table. It is very much asked in any NEET PG or INICET question. If it is the presentation, what is the interpretation? Okay. Please either understand this thing or try to memorize this table. I think previous one was much easier. You cannot remember this much thing. Okay. It is, it comes usually 1 year after another in any form. Okay. Sometimes it's a table, sometimes it's a clinical scenario. Okay. Please remember the table or the sequence of events. Prevention for vaccination you have already read. What is the NIH schedule for hepatitis B vaccine? 0 dose তারপর আর দেব না 6 10 14 দেব কি দেব না সে তো ওপিভি আছে আর দেব কি হ্যাঁ দেব না আচ্ছা আরেকবার আসবো তো পরের টেবিলটাই ছিল what are the treatments? You will read much more on it, Harrison. Okay, please try to follow the latest one guideline, and also one cases scenario was also given in PARC. Also one down arrow, that is program how to manage a hepatitis B case is given. Okay, try to read that part. What is the main drug? That is lamivudine. Okay, and adivovir or Hepsera is the common name. Okay, these are the 5 C's that we have to maintain while treating a hepatitis B patient. That is consent, confidentiality, correctness of the diagnosis. What was the stage of the patient, whether it's acute or acute on chronic or late chronic, that was the correctness. Okay, we have to remember these things, and also we have to counsel the patient about some behavior. Okay, if that is the counseling is important, and connection, we have to connect, otherwise the patient will not adhere to the treatment. These are the only simple things. Hepatitis C, it's infectious. Overt jaundice, it is commonly seen in hepatitis C. Okay, and hepatocellular carcinoma is also commonly associated with hepatitis C. These were the structure, incubation. Here it is 4 months. Mode of transmission, IV drug use, healthcare exposure, that is blood transfusion, transfusion of blood products. Screening for hepatitis C and hepatitis B is mandatory before getting a blood from a person or before transfusion to a person. Okay, there is a list of tests you will read about in medicine that you have to perform before transfusing a blood bag to the patient. Okay, they have to give the clearance, even blood bank, they have to give the clearance on those accounts. Okay, that is hepatitis B and C detection in the blood bag is one of them. Okay, these are the infection, the course. It is not important like hepatitis B or A. Okay, diagnosis is mainly by hepatitis C virus antibody, RNA or antigen. Okay, what are the prevention? Only general prophylaxis, no specific active or passive immunization agent is available. That's why we screen that much for it. Okay, because no treatment is still available. D and E is not that much important. T is hepatitis delta virus. Okay, that's why it's still D, and it contains a small circular enveloped RNA virus. And what is the it is also known to be a subviral satellite because it propagates only in the presence of hepatitis B virus. That's why co-infection of hepatitis B and D is much common, about 5%. Okay, what are the structure? That is one virion and one is satellite virus. Replicates is only in the presence of hepatitis B. Incubation 12 weeks, very less. What are the mode of transmission? Similar to those of hepatitis B. What are the clinical feature? That is always co-infection and super-infection. Co-infection, delta and HBV are transmitted together at the same time. In super-infection, delta infection occurs in a person already harboring hepatitis B virus. It is asked in your viva. that what is co-infection and superinfection for hepatitis D virus. Okay, diagnosis, again delta antigen, we usually see it in immunofluorescence, anti-delta antibodies appears in ELISA, IgM antibody appears 2 to 3 weeks after infection. Okay. Hepatitis E, that is viral hepatitis caused by infection with virus called hepatitis E. It occasionally develops into acute or severe liver disease. Okay. Sometimes fatal. In pregnant women, the disease is often severe and is associated with a clinical syndrome called fulminant hepatic failure. It is very much asked, a very common MCQ, that fulminant hepatic failure or fulminant hepatitis is seen in pregnant women associated with which infection? Hepatitis E. Okay. Sign symptom is not that much important. Incubation 9 weeks, animal reservoir for hepatitis E, remember, that is pigs. Mode of transmission, again fecal-oral route, this is not important. Diagnosis, again by ELISA kits, prevention is sanitation. Hepatitis G is not much important. Now coming to the national program, that is viral hepatitis control. It is launched in 2018. Usually it is for A, B, C, D and E. So what is left? G and F are essentially left. Why B and among those hepatitis B and C are responsible for 96% of mortality. What are the burden? I already told you, that is always remember the word 5. These are the progression of liver disease. What you will see, that is cirrhosis. Okay. What is cirrhosis? By pathological means? What is the meaning of cirrhosis of liver? Replacement of normal hepatocytes with কি টিস্যুটা কি গ্লোবুলার তো নয় হলো আর fibrofatty tissue or scar tissue, what is that? What is the pathological term? Cirrhosis. What is the replacement of which type of cells or tissue? পড়ে নিও আজকে। What for this viral hepatitis control program, what we have to remember? What is the aim? It is countrywide elimination of hepatitis C by 2030. Remember one point, that is hepatitis, their combat against hepatitis B and C is commonly associated with SDG 3.3. Okay, it is asked in Viva or in semester. Okay, sorry, Viva or in MCQ. There is much more, not that much things are there. Okay, what are how to hepatitis B targets? That is 90% coverage of 3 dose. Okay, not even 4 dose. Up 3 dose among 4 dose. Okay, usually we have to give 4 dose, 0 dose, 6, 10, 14. But among those 4 dose, 3 dose of immunization have to be given to the child. That was the target. 90% coverage of timely hepatitis B birth dose. 90% of person affected must be aware of their status. That's why the counseling is that much important. Okay, and 90% of person diagnosed has to be treated. What are the target for C? 90% of affected must be aware and 90% only be treated. There is no prevention or immunization against hepatitis C. Okay. What is the India's target? Again, it is written the same. We have National Viral Hepatitis Management Unit, state and district. That is the organogram. Okay, they are only involved in the immunization and the awareness creation and nothing else. Okay, just remember, if it is asked in your Viva or if it come as short note, you can write. Only 3 division, no nothing specific about there, what they are concerned about, how many cases are there, and we have to create awareness and we have to maintain the supply chain. These only 3 things: supply chain of vaccine, supply chain of drugs. Okay, nothing else. Do not have to remember this thing. These are the treatments. this is the where the screening start, that is PHC. Okay, I gave this table because it is asked once. The hepatitis B screening starts from which level? That is PHC. Okay, once asked screening, next time it will ask the treatment. So treatment start from district hospital. Okay, and medical college with specialized center are for resistance or everything or research purpose, nothing else. Okay, so no hepatitis and eliminate hepatitis. The challenge and opportunities, and that's the what are the main challenge, that is awareness and the stigma associated with it.